Today, we're talking about one of the more commonly asked questions from my clients, probably because of some things I've said in past videos. So today we're going to cover it a little bit more in depth. If you want to know about the state of healthcare in Vancouver, Washington, and generally in Clark County, Washington, stay tuned. Welcome back to Living in the Pacific Northwest with Byrd. I'm Byrd. If you are new to this channel, I have been creating content about the Vancouver, Washington and surrounding areas. I'm licensed as a realtor and I'm a certified relocation and luxury specialist in both Oregon and Washington, so I can help you pretty much anywhere in the Portland metro area. I have an amazing team that has developed over time because of you guys watching the videos and coming to work with us, whether you are moving to or within the Portland metro area. We are so grateful and happy that you're here. And this channel is really born out of my husband and I wanting to know more information when we relocated 7 years ago. And this kind of information wasn't out there. There weren't people making content about this area. And so we wanted to be the friends in the Northwest that we didn't have at the time. And then we've built out an amazing community. We always say when you work with us to buy, sell, or invest, you don't just get a home, you get a community. And you can see that from our plethora of videos about our different events that we host throughout the year and just fun things that we're doing with our clients. We love to make the process of relocating or selling or just, moving from one part of town to another fun and stress-free. And that's really what we're about. Now, today we're talking about a little bit of a more serious topic in the sense that healthcare is so important to your lifestyle, especially if you have health concerns or if you're aging. I mean, all of us are aging, as my husband would say. He glanced over at me as we're filming. But this topic is just so important. And so we're going to cover what it's like. And the reason why we're making this video is because I came across this article in the Columbian about a man in Ridgefield who had to wait hours for an appendectomy to get his appendix out and ended up in sepsis. And so we're going to talk about, I'll share kind of what that article states and then what our personal experience has been like and kind of the general landscape of healthcare. If there's anything that you want us to go into more specifically, we'd love to hear it in the comments, or if you have a healthcare experience in the Portland metro area, I'd love to hear it. Today, we're going to be focusing specifically on Vancouver and Clark County. So if you want a video on Portland healthcare system, we'd be happy to do that. Just let us know. So without further ado, let's jump right in. So the first thing we want to cover is that we have two major hospitals in town. We have the PeaceHealth Southwest Medical Center and the Legacy Salmon Creek Medical Center. So PeaceHealth, or some people call it Legacy or Legacy Salmon Creek, are in two different locations. These are the only two hospitals in Clark County. So you've got PeaceHealth, which is off of Mill Plain in a very central part of Vancouver. And then you have Legacy Salmon Creek, which is in an unincorporated area of Vancouver called Salmon Creek. If you're looking at a map, it's right where 205 and I-5 meet. By the way, for any of you from California watching, I am really started to notice this year how much I've colloquially distance myself from California because I never say the in front of the highways anymore, but the second I go home, it's the 5. So in California, it's the 5, but up here, it's I-5. Just kind of funny how it's like split in my brain. It's besides the point. So PeaceHealth is a 450-bed hospital. It was actually founded in 1858, which makes it one of the oldest hospitals, or the oldest hospital in the Pacific Northwest. And it offers services ranging from surgery, emergency medicine, maternity care, cardiology, and a certified stroke center. It is a level 2 trauma center, and it's been notable for its environmental sustainability efforts, as well as having a training program for the University of Washington. Legacy Salmon Creek also has maternity services, emergency services. It has some advanced surgical options, and it's a level 3 trauma center. We don't have any level 1 trauma centers in Southwest Washington. So those are the two main hospitals. If you ask around town or locals, like if you look online, you'll see that people are pretty split 50-50 on which hospital is preferred. So it's there's not a clear cut. Some people absolutely love PeaceHealth. Some people swear by Salmon Creek. Neither myself or Jared have been in the hospital. We did have a client who moved up, and shortly after he moved up as a single retiree, he had a surgical procedure at Legacy, and he was very, very happy there. So barring needing to be in the hospital, I think that the way most people interact with the healthcare system is through their primary care physician. And I can speak to our personal experience about this. When we first moved here, we had Kaiser, and now, being self-employed, we have more of a health share plan. We don't have, traditional health insurance, mainly because we don't need it, given that we're relatively young and healthy. So there are numerous primary care options. I will say that we've had the best experience personally. I've seen 3 doctors in my time here, and technically 4. And we've had the best experience at the Vancouver clinic. The Vancouver clinic is a little bit like Kaiser in my mind, if you're familiar with Kaiser, in the sense that they have a lot of stuff in-house. They have facilities all over the county, all over Vancouver. Most of, I would say, the main primary care location is actually just next to Legacy Salmon Creek. So Jarrett was able to get assigned a primary care physician right away because they have a residency program. And so those residents don't have as full of a client roster because they're new patients. They're supervised by experienced doctors. He's been really happy with that experience. I also started with a resident, and he just wasn't really a good fit. So I found a DO that I really liked last year and requested an appointment in May, and her schedule was full until November, December. And then she ended up going on maternity leave. So in that time between when I initially booked the appointment to when I was supposed to have my appointment, she was just going on maternity leave. So the next available appointment she had was the following May, and that's May of 2025. So I just had my established care appointment with her. But so it took about a year. I would say not a common experience because not everyone's doctor is going to go on maternity leave. And now, from that established care, I have a couple follow-up appointments, and I was able to get those in right away within a couple weeks. And then I was going to be out of town, so I scheduled the next appointment 2 months out. So once you've established primary care, it's not as difficult to get an appointment. It's also not as difficult to get appointments with specialists in our experience. It's much easier to get appointments with specialists than with primary care. So I would say if you're moving here and you can get your insurance set up in advance, or you can just pre-plan establishing primary care and doing your research on a doctor, that's probably going to be the longest wait in our experience. And then if you don't have primary care established, there's plenty of urgent care facilities, tons of urgent care facilities. I think I've been to 3 of them, and they've been great. We've been to, what is it called? Legacy Go. And we've been to the Vancouver clinic urgent care. No complaints whatsoever. Great, fast service. You can even make an appointment from home at the Vancouver clinic urgent care. So they can tell you there's an availability in 20 minutes. And I like some of the technology that they have. All of the healthcare providers we've been to use MyChart up here. I don't know if that's common in other areas, but I really like that too because it transfers over, if I go to urgent care, my primary care physician can see all of that. And so it's very seamless process. You can message your doctor, there's telehealth, there's all these, it's modern healthcare, not great, but better than it was 10 years ago, in my opinion. And that may be controversial. And then also I wanted to talk about ancillary services. So if you're looking for an eye doctor or dentist or chiropractor, masseuse, all of those things are super easy to find and abundant. There was a joke in the Ridgefield Facebook group the other day because someone had mentioned that there's a new dentist office open, and someone was like, oh, just what Ridgefield needs, another dentist office. So there's plenty of options in that way. No issues there. And that brings us to health insurance. I think this is worth touching on. So there's a variety of ways you can get health insurance in Washington. The state has a state-operated marketplace called Washington Health Plan Finder. So the major insurance carriers in Vancouver are going to be Kaiser Permanente, Blue Shield, Blue Cross Blue Shield, Molina, and Community Health Plan of Washington, which are low-income health plans from what I understand, and then United Healthcare. Washington also has, for Medicaid coverage, Washington Apple Health, and that's available for eligible low-income residents. So if you are thinking about relocating here, like I said, I would take your time and do your research early on selecting a primary care physician, make sure they're accepting patients, make sure they take your insurance. I mean, all stuff that, you guys are intelligent people watching this channel. I'm sure you've navigated the healthcare system, and some things are better than others. What I will say, and circling into why primary care is so difficult to establish here, if you're looking at this Columbian article, this man, his name is Tom, he developed severe abdominal pain, and they called an advice nurse with Kaiser, who's their insurer, and they recommended he go to the emergency room. So they went to PeaceHealth because it was the closest Vancouver hospital that's contracted with Kaiser. Just to note, my client who moved up here and went into the hospital shortly after, he also had Kaiser, and there is a Kaiser hospital in Portland, but he lived in Vancouver, and they took him to PeaceHealth. They were full. This is a couple of years ago. They were full at PeaceHealth, and so then they directed him to Legacy. So you can go across the river. I do have 2 clients who have cardiologists at OHSU in Portland. So you can go across the river for certain procedures. I haven't tried to do that, so I'm not quite sure how it works. But I do know that you can live in Vancouver and get healthcare in Oregon if you need, more advanced or in-depth specialist procedures, etc. And if you're not familiar with the kind of lay of the land, I do have a video here if you're looking to know more about the different areas of Vancouver. But where we sit, and I mean Vancouver generally, we are about 15 to 20 minutes north of Portland. There are several hospitals there. There's the Kaiser Hospital, Providence has hospitals there, Legacy, and OHSU. And then if you go north about 2-3 hours, depending on traffic, you can be in Seattle. So if you need highly specialized care or surgery or, world renowned, the Portland metro area has some amazing ranked hospitals, and Seattle, I would say even more so in terms of specialty care. So we're kind of, I would say, geographically sitting in a good spot. So going back to the story of this man who didn't get care right away, he ended up waiting hours for his appendectomy, which is obviously an emergency surgery, and he went into sepsis. And this was what was told to them when he arrived at the Kaiser facility. But they said that they were short on nurses, and they were actually only working out of one operating room. And the reason I want to bring this up is because since the pandemic, since February of 2020, there has been a nationwide decrease of almost 100,000 healthcare workers. And as of 2023, about 28% of all healthcare workers had intended to leave their job within 2 years. And about 41% of nurses indicate that they would like to leave their job within the next 2 years. So what that tells me is that people are leaving the healthcare industry just because it has been so tough over the years, and I don't think the healthcare system has really recovered. I do notice that a lot of my clients that are moving here are in the medical field, whether that's residents or nurses, and there is a high demand, especially if you have a specialty. There was an NP that I spoke to who said that they were offering her, comparatively to other markets, specifically to be in Vancouver, they were like, this would be your bonus if you work at Legacy in Portland, and it was X amount. And this would be your bonus if you work in Salmon Creek. And it was substantially higher, almost 100% higher bonus, sign-on bonus to work in Vancouver. And so when she called me, she was like, is there something wrong with Vancouver that I don't know? And I was like, no, we just have a shortage of healthcare workers here. And I think that the bonus is tied to needing more people to be here, specifically in Clark County. So that's kind of the state of healthcare. I hope that gives you a good high-level overview of where we're at, what sort of specialties are the most difficult to get appointments at. I have highlighted a story from some of my dear clients. I've helped many of their families move up here, and the grandparents, one of them was on dialysis, and it took them a long time to move up here to get a seat at a dialysis center. So if you were looking for a business to start, dialysis center might be a good one. But they are very much about doing things the right way. And so they were on the wait list for a very long time. I want to say at least a year, maybe a year and a half. Part of that reason is because they kept getting bumped down on the wait list because people would move up here without securing a seat. And so then they get moved to the top of the list. So while they waited in California for a seat to be offered to them, other people will move up here and just, the dialysis center, I guess, has to put them at the top of the list. I'm not quite sure how that works, but just another anecdotal story. So it depends on the type of care you need. Specialists are not as difficult to come by. Primary care, I think, is going to be the hardest to establish. So if you have major procedures coming up and you like your doctor and your healthcare setup where you are, I've had many clients say, I'm going to get my cataract surgery down here. I'm going to wrap up my procedures down here, before I make the move. So that is something to consider. If you're looking to buy, sell, or invest in the Pacific Northwest, make sure to shoot me a text at 360-818-4438. My team and I would be happy to help you in your relocation. We're so excited to hear from you. Make sure you like this video. Check to make sure you're still subscribed. And if you're not, please subscribe. It really helps get the channel out to the right people. Obviously, the people that I continue to work with, I just enjoy them so much. I enjoy our audience and the community we've built. And so I want more people like you that are watching this video to be in our world. Leave a comment, like, share, subscribe, all the YouTube things. You guys know how it goes. I'll catch you guys next time. Ciao.